So there are a tremendous amount of physicians out in the traditional broken system that hate their jobs. They want to go do something that they love. They don't know direct primary care exists. Here's the solution. My name is Dr. Mike Garrett, and I'm a family physician with the direct primary care practice in Austin, Texas. So before I got into direct primary care, I finished residency in 2000, did a residency in family medicine. And even then, when I was in residency, I could see that I wanted to do family medicine, but I couldn't do family medicine in a traditional family practice office where we were being expected to see 20 or more patients a day and spend 10 or 12 minutes per patient. So in a direct primary care practice like mine and Dr. Ikbal's, we spend an hour with each new patient and 30 minutes on typical follow-up visits. In a traditional practice, people have half-hour appointments, 15-minute appointments, and often even less, 7 to 10-minute appointments. It's just not enough time. The current traditional medical system is broken. Patients know it and doctors know it. Doctors don't have enough time for their patients. They're swamped with paperwork. They're seeing 20 or 30 or more patients per day, and they don't like their jobs. So doctors don't like the sense of being rushed. They don't like dealing with paperwork all day, which now has become more than half the time they spend is spent on dealing with paperwork. They don't like not having enough time for their patients. They don't like not having enough time outside that for their family. And I guess I would say too, in contrast, when you talk to direct primary care physicians who are doing it, they tend to like or love their jobs. They enjoy what they're doing. And that's what you want in a doctor. You want a doctor who likes doing what they're doing. The most important thing for me, the reason that I started my direct primary care, is autonomy. I want to be able to practice medicine how I see fit and not have that be dependent on Medicare or Medicaid or some, third-party insurer telling me how to practice medicine. And I think that's too often the case in traditional practice. And in direct primary care, there's no one between me and the patient. So Dr. Katriny and I met at a conference where people were getting together and talking about direct primary care. And I was done with ER and she was done with urgent care, and we both started a direct primary care practices. I do consider Dr. Katriny a pioneer in the direct primary care world. She started this 6 years ago, and it takes tremendous courage to start something new from scratch that's an unproven idea in your area, and she did that, and she's had a good, successful, established practice. So I still frequently meet physicians who have never heard of direct primary care. So I think it still is a well-kept secret. We're trying to let people know. It's changed my life. I love my practice. I love being a family doctor again, and I think every family doctor needs to know about it. So I would say to any doctor that's unhappy with the practice of medicine as they see it now, and that's usually anybody in the traditional system, they should strongly consider direct primary care. If they want to love their job, that's the way to do it. Yeah, I think joining an existing direct primary care practice is an optimal solution. It avoids the staying in the system that you know is broken and giving poor care or timely or rushed care and hating your job. But it also avoids all the massive risk of starting your own direct primary care practice. You're joining a practice that's already existing. They've got systems in place. The infrastructure and overhead is already largely covered. So you remove a lot of that risk and join an existing practice.